All right, so let's quickly have it and talk about the differences between what osteoporosis and osteopenia. Osteoporosis and osteopenia. So if you ask me the difference between osteoporosis and osteopenia, yes, both of them are conditions that actually affect the bone. Do you understand? But if you ask me the major differences between osteoporosis and osteopenia is yes, there's lots of density in both. But osteopenia is like a junior brother to osteoporosis. Do you understand? Osteopenia is like what? A step or a process where you pass before you go toward osteoporosis. All right. So from osteopenia, when it gets worse, that's when we say it is basically what osteoporosis. Okay. So that's it. Okay. So let's talk about the differences. When we hit a point here, we hit a point here. Okay. So for density, we say that what osteoporosis is characterized by what significantly what reduce bone mass and density. So it will make your bones weak and brittle. While for osteopenia, it's a condition where the bone density is lower than normal, but not low enough to be classified as what osteoporosis. Okay. Fracture risks. Individuals with osteoporosis have a very high risk of fractures even when they just fall with a minor fall. Okay. Then the risk of fractures is lower here compared to osteoporosis. Okay. Common site is most commonly in the hip, wrist, and spine. Here, the hip, wrist, and spine can also be affected. That's one of their similarities again. Now, causes. It is often due to things like aging, hormonal changes, especially in women that have gone past what? Menopause. Okay. Especially women that have gone past menopause. And people who have deficiency in calcium and vitamin D. Okay. So it's similar to osteopenia is also similar to what? Osteoporosis. Of course, it's the same things, same consequences coming up. Okay. So but you actually pass osteopenia before you get to what? Osteoporosis. What is the symptoms? Symptoms can be often asymptomatic until a fracture occurs. Here it is usually asymptomatic until you dictate it on routine bone density scan. Okay. What is the diagnosis? Is bone density scan. That's what X-ray, dual X-ray absorptiometry. Okay. I see that the score is what less than 2.5. While for osteopenia, the score is what between 1 to what 2.5. Okay. So that's just it about what the major differences between what osteopenia and osteoporosis.